Okay. Quite a few people have registered, so we'll see how many turn up. I'll share my screen in a moment. Okay, I think I'll get going because we can never be sure how many people are going to come. Now I know that, here we go, another person coming in. Okay, could someone please indicate to me if you can't see those slides? Otherwise, I will assume that you can see the slides now. I'm adjusting my window so I can see the chat. Okay, looks like you can see the slides and I'll be able to see anyone coming in. Okay, so thank you very much for joining me this evening. Welcome, my name's Anita Fletcher, and for those of you who don't know me already, I founded Standout Medical Careers in 2020, and I've been working as a medical career coach for 10 years now. So I've got a fair bit of experience working with the SMOs, and I imagine that you're all here because you've got interviews coming up. So without any further ado, I'll get straight into it. So this evening, there's a fair bit of ground to cover, and I'm happy to stop the recording at the end and take questions in case anybody would like to ask any questions. And I'll need to keep letting people in as we go. So essentially, you're here because you're applying for senior roles that require really more than demonstrating your clinical competence. So at the SMO level, interviews are an opportunity for you to showcase leadership, strategy, and your alignment with service priorities. So tonight we're going to explore what these interviews are really assessing, the themes that you're likely to encounter, how to structure your responses, some example questions, and some preparation strategies to help you feel calm and capable. So at senior levels, interview panels are typically made up of health executives, department heads, and clinical peers, and they're assessing your ability to lead, influence services, and work across systems. And you might be expected to speak to workforce issues, quality, and long-term service goals. So in public roles, the focus might be on equitable access, resource stewardship, and leadership within policy settings. So these are the areas, as I mentioned, that they're looking for in addition to your clinical skills. And I always encourage people to look back to college competencies and certainly the position descriptions, and you'll find that these are some of the main areas that they want to understand about what you have to offer that is going to set you apart from your peers who may all be on a very similar clinical footing. In the private sector, the focus changes a little bit. So it becomes a lot more about how you can contribute to the business, grow the business, and innovate so that to introduce additional services. And look, it's not to say that those things aren't also considered in a public setting, but obviously working within a private setting, it's much more business focused. So that's worth bearing in mind as well. So some of the key themes that I wanted to touch on this evening include these next four aspects within these four slides. So leadership and team dynamics. What people are looking for is really how you've led through uncertainty, what kind of contributions you've made to the team, how have you stepped up, how have you taken a leadership position when there's been a time of difficulty, or even how do you do that in the good times when you're working with the executive to deliver the objectives of the health service more broadly. So often with these positions, it's really wise to have a look at the strategic direction of the organisation. So you're looking at the bigger picture rather than not just within the department that you're going to be working in. You're looking at the broader context of that department and that role. So you're becoming one of the key people within the organisation who is liaising with the hospital executive, leaders of other departments. So they want to know how you're going to interact with those other stakeholders, which is covered in another slide coming up. But also really importantly, how you then develop a strong team culture and lead the team that you're working with. So the other clinicians through to allied health, nursing staff, what is the tone that you're able to set within an organisation, and is it aligned with the broader organisational goals of the health service on a bigger scale and potentially a whole network. So that's one of the themes I wanted to mention. Quality and safety is another one. Just about every person that I've worked with that has gone for an SMO role has said afterwards, yes, quality was a theme, also safety. So, I mean, obviously, clinical governance and risk is what this is all about, and everyone's beholden to governance as a way of ensuring that they're operating the service to the highest possible standards, and they are the measures that are assessed from external bodies. And one of the things I like to talk to SMOs about is, if you aren't already familiar with the NSQHS, the National Safety and Quality Health Service Standards, please become familiar with those. There's often questions in interviews that directly refer to those, and if there isn't a question but you identify that what they're talking about is this area, it doesn't hurt to refer to the NSQHS to show them that you're aware of what it is and what it means for organisations and the leaders working within them. So another sample question, and I'll have more of these later on, but it could be around how you promote a culture of safety. So these are, as I said, topics that you need to consider and think about potential questions for the interviews. I probably should have included a few more. I've got a few other questions at the end to mention to you all, but I hope this gives you a sort of an idea of some of the things to really start thinking about. Risk is a big theme for organisations, and a lot often, well, at the executive level, they're thinking about it not only when something goes wrong. On the ground level, often people think about it after the event, when they're then reacting to a problem that's occurred. But the executive are trying to maintain those standards in order to prevent any, unfortunate and unfortunate outcomes that are not going to reflect well on the health service and the individuals within them. And I think we're all familiar with examples of when those stories come up in the media, and they can have very significant ramifications for the health services and also for the individuals involved. So please go in with some content around quality and safety and be able to speak to examples of when you have delivered new projects, new initiatives for quality and safety, or implemented them. Have you been on committees where quality and safety is discussed and developed? And really have a look at the position description in terms of what the expectations are around that position for you, for the candidates, and how are you going to talk to those points in the interview. Another example here of strategic thinking, possible question is, how would you develop a new model of care? So, you know, you need to think about that, and you need to, as I say, refer to any documentation that exists that can help you understand what their existing models of care are. And that information is often very easily available via the internet. I was working with a senior medical officer recently who was going for a position, and she shared with me quite a long, very in-depth document, which was put out by the large health services executive, which really clearly talked about, this is our strategic plan for the next 10 years from 2026 to 2036, what we want to deliver, what we need to keep in mind. So what's happening with the population growth, change in demographics. You know, it was a really, really interesting, content-rich document, which included examples of, you know, their forecasting in terms of how short they're going to be, how many more beds they need to meet demand, basically. So the challenge for them and what they were really focusing on was new models of care, which took away from, took some of the pressure off the demand for inpatient beds. So think about these things, go looking for the content. There's often links within the job ads and within position descriptions, or there's a reference to those documents. So follow those and do your research, because they'll know, it will come across in the interview that you have done some research into those really important factors for them. And of course, you don't need to know all of it in depth, but by showing that you understand some of their main goals and objectives and how they do things, that will put you in a better position than if you don't do that research. Stakeholder engagement's another really important core concept. As I mentioned earlier, I briefly referred to, you know, that position that you're in, a position of higher authority, and there are expectations around SMO roles in terms of the way that you engage with other people within and outside of the organisation as well. So I guess the first place that our minds might go when we think about that is the different disciplines that your discipline is interacting with within the system, and also different services. So, you know, and some of those might be external services as well. So what's your experience been working across disciplines and with different services? Think of some great examples that you can refer to with that demonstrate successes and what your role in those successes has been. And then, of course, we can always anticipate conflict questions in any interview, and that doesn't stop at the SMO level. It's often there that, you know, conflict becomes a key feature of leadership roles, because they need to be addressed, and the buck really stops with people at this level, this professional level. And the people in the executive are expecting the SMOs to be dealing with conflict in an appropriate way and sorting out issues. And certainly within teams and disciplines, and then across different disciplines, working with colleagues in other areas. So, you know, that's obviously a whole area that could be potentially fraught with challenges for people, and how you handle difficult situations is something that's definitely coming under the scrutiny of the interview panel. So I'm moving pretty quickly through all of this, jumping from idea to idea, but I hope that's helpful to you. And the reason is we don't have a lot of time in a 45-minute webinar. This is really an overview to get you thinking. So people often ask me about how can I structure my responses. In fact, I had a meeting last night with somebody who is applying for a fellowship position this year, and he said to me, I know that that's an area that I need to work on, and it's extremely common. That's a framework that I think most doctors have experienced, seen, certainly in my webinars over the past 5 years, and no doubt during your careers you've come across that framework. It's very common, but I put this one up because I think it's a really great one to fall back to, always go back to. Basically, people want to know when, you know, if you're telling them about a time, say when you mentioned handled conflict, but within across disciplines, this is a simple thing to put forward, and you need to tell your story. So what was happening? What did you need to do? What did you do? What changed as a result of your action? And what insights did you gain? And how did that change things, not only for your practice, but potentially for the group of people that you were working with? And, you know, ideally, you're obviously going to draw on experiences that had positive outcomes for people and the team as a whole. So keep that framework in mind, because I think it's a really useful one to fall back to when you have to provide an example of some of your work. So, you know, and think about what were the outcomes and how you contributed to the change, and not just what you did personally. Involve other people. So really think about how you're going to tell those stories in the most effective way when it comes time to relaying those at the interview. A couple of examples now. So these are questions that you might be asked. These are ones that I've heard people having been asked in interviews at this level. So a time that you tell us about a time you improved a service or a system. And you know, you might have to think back a year or two, and that's perfectly all right. Obviously, recent examples are really strong, but so are other examples of your recent past. And again, hone in on, really think about what were the results, and it's up to you to tell this story in the interview. The panel will have your CV, or they may or may not have read it. I would expect that they would, but people are often very busy, so they may get a fairly cursory look at that, and then some time might pass, so they won't recall everything on your CV. So it's really your job to know what's on your CV and also what you want to highlight from that. But also, often in our CVs, these examples aren't in there. So you really need to think through those core themes. So there's your quality improvement theme there, and formulate a question that could be asked around that, and think about what might they want to know, and then collate some content, a good story around that. How you've contributed to cultural or structural change. So again, your contribution and change is such a key expectation of people in more senior positions. You know, when you're in your early career years, it's about fitting in with the system and doing the job, learning the jobs, and yes, starting to potentially introduce improvements and changes. But certainly as you get into the more senior side of things, then it is expected that you're going to manage that, because it's, as I said before, that's sort of the buck stops with the SMOs within the team, and the heads of their department. And the heads are looking to choose their team, work out who do they want, who's strong, who's going to be able to support them when there are times of challenge or opportunity. But when they can't be at all places at the same time, and they need to call on key members of their team to contribute. Again, the challenging team situation, how did you handle that? Apologies, I flicked over there too early. And then, and I think everybody can think of one of those. So, you know, again, tell a story, how you handled it, and draw on your strengths to illustrate the skills that you use in those types of situations. And with all of these responses, I'd really encourage you to not fall into the trap of answering the question at a very shallow kind of level. The panel really want to hear more. They want a story. They want more detailed information than a couple of sentences, because, you know, you don't want to appear that you're just giving this answer and you sort of almost like you want to get out of there. You want to show them that you're engaging with this process, and that you have content that you've thought about and that you are eager to share with them, and utilize the time that you've got. So even if it's only a 20-minute interview, which many of these interviews are, you've got a few minutes at least for each of the questions. So the person that I was talking about before, who I worked with recently, I think she said it was a 20-minute interview, but they had 10 minutes beforehand to look at the 5 questions, and they were allowed to make notes on those questions. And she afterwards, actually, she said to me, "Oh, I was feeling so ready and prepared and really good about it all, until I sat down and I had those questions and I froze when I saw the first one." So luckily she regained her composure, and, you know, she was off to the side. She wasn't in front of the panel. She had that 10 minutes to put some notes down. But she said, and I'm pleased that she did this, she moved past the first question and started looking at the second question and writing notes on that, and then came back to it. So, you know, whatever works for you, but obviously do that. But one of the key things too is really maintaining your composure in that moment of stress. So even if you're not off to the side, if you're in front of the panel and you feel unnerved by either people on the panel, how your confidence suddenly starts to walk away from you, pull it back, regain yourself. And if you get stuck on a question, ask for them to repeat it, buy some time, and then really focus and regroup on what are the key things that they're looking for here, and try not to panic, and draw on some of those key pieces of content that you've prepared prior to the interview. And this is why, for me, I'm all about preparation and practice that's what I recommend to people. I recommended that to the doctor I spoke to last night who's applying for fellowship. I said, even if whether or not we work together, please start getting some work in on this now. And he said, oh, the problem is, of course, young family and lots of work. And it's hard to find the time. And I said, please make the time, even if it's 10 minutes, if it's every 2 days, even if it's half an hour at the end of that extremely busy week. Put the time in and do some preparation, and it will reward you with greater confidence and better responses when it comes time to coming out of the interview. I can almost guarantee it. And then what do you see as the future of the service? What role could you play? That's a very typical interview question that you could be asked. And it's pretty open. It's really asking you as well, well, have you done your research? Have you done your homework? Do you know what we do here? And do you know what our role is in the context, the bigger picture within this city, this state, the network we're in, the other hospitals? What's the future? What's the demographic doing? What are the issues? Do we have funding cuts that we have to worry about? Are there knock-on effects from what's happening with GPs? What is it that's going on? And how do we want to improve? What are the services goals? And then what do you offer as part of achieving those goals? What role can you play? What can you bring to our organisation? So I did some webinars a few weeks ago, and one was merely on the theme of understanding and communicating your value. Because if you can't do that, people aren't going to know what it is. And again, that is very much up to you to do it in an interview and show people that you've considered it. Recently, somebody else, another senior person said to me, I'm concerned that last year I didn't get the role because I think they might have thought I was a bit laid back about the process. Well, they're now having a conversation with me this year so that the same thing doesn't happen to them this time around. So you can't be perceived as being laid back or expecting to get this position in any way. You've got to show that you're serious about it, and that your ego and enthusiasm goes a long way as well. Why do you want to be there? It will come across. And that can be the deciding factor between candidates for the panelists. Okay, I won't keep going on. So, I could talk about this all day. So now I hope that those sample questions give you a flavour for what they're looking for. And then how do you prepare now strategically and efficiently? Well, I think I've sort of covered off on some of these already. So I am always talking to people about position descriptions. Send it, if we're working together, if I'm working with a doctor, I say, please send me your CV, any of your application documents, the position description, the ad, anything you've got around that role. I want to see it. So you should be taking the same approach, do that research, look at it. What are they looking for? I'm amazed at how often people are not reading those documents. They say, oh yeah, I had a look at it. But and again, everybody's busy, but there's a reason why they've given you that 6-page document. And it might seem like it's just a sort of pro forma from the organization. It's not. Even if it's been used before that position description, they've still reviewed it and looked at it and decided that, yes, this is what we want to put out for this, this process, this application and recruitment process. So they're taking it seriously. You need to do that as well, and you will find a wealth of clues and information about what they might raise at interview and what might be of interest for you to talk about with them. And they'll know that at very least you've paid attention to that, which will go down very well. And org structures. I love looking at the org structures and seeing that position. Where does it sit within the broader service? Who are the stakeholders all around that position? Who might you be liaising with? Who might you have to communicate, collaborate with? What committees are in existence? What are the issues? How are we all going to work together? So look at the position description often has what lists some of the key challenges of the service as well. So it's giving it to you on a plate if you take the time to read it, and then line it up with your strengths. Show them that what you have to offer will help resolve those challenges that they're facing. As the second point says, identify any strategic projects that they are interested in rolling out and bring to them. I show them examples about how could be able to make an impact on those. And I could give you so many examples of people I've worked with even this year who have had these opportunities, and then we've worked together to identify what are some of the key pieces of information that you could be putting forward in this very limited period of time, really. We've been here for over 30 minutes, so the interview's already over, in a lot of the interviews that are shorter than that. Definitely practice speaking aloud and record yourself or use mock interview support. So whether that's in your health service, I've actually got a mock interview mini workshop coming up on the 3rd of May. I'll share some details at the end about that. And then, as I said, prepare these. I've put in here 3 or 4 sort of anchor stories that you can adapt across the questions. So think about what are really good examples of your work and that demonstrate the skills and your strengths that you've utilized. And, that might be your excellent relationship with people, your ability to build a rapport with patients and other colleagues. Whatever those stories are, you can then draw in on those to answer different types of questions. So prepare those with that lens of thinking about the competencies, thinking about the key selection criteria. If I tell this story, how can I refer to some of those other concepts that might come in so I can call on that story for a range of potential questions. And really, usually there's 5 questions. So 3 or 4 stories is definitely going to have you covered. And you might not, they might not even require examples from the past. And again, they might not explicitly ask for them, but you can still make reference to good results that you've had in the past. So do that preparation. A few final tips. What will I say? Sorry, I've made some other notes here, and please prepare any questions that you have. You can put them in the chat. I'll turn off the recorder in a minute. or unmute. Would be great to have a conversation. So really read the room, and by that I mean not only when you get to the interview, but reading the position description and talking to people who work there and potentially meeting people. If there's a meet and greet or some kind of informal process, if you want to go and work in a department, it's perfectly acceptable for you to contact the head of the department or the person who's the contact person for this role and ask if you can go in and meet people and have a look around. That's a great way for people to identify you, get a first pre-interview experience of you, meet you, and that's a golden opportunity. If you get that, please be proactive and seek it out, and then grab it with both hands. And then you can read the room. That's a really great fact-finding sort of mission that you can do to get the feel of what is this place like, who's working there, what's the atmosphere like, and you'll really pick up then on what is important to them. And then in the interview, listen to the questions, because that's also going to be showing you what matters to them. They're assessing the candidates based on those questions. Your preparation is going to help you be clear and calm, and really importantly, being concise. So don't waffle. I had someone say the other day, oh, my problem is that I waffle. So if you're aware of that, you need to work on it. So you work on it through this preparation and practice. There's no getting around it, and you'll be so glad that you did. It makes you feel better. It makes you feel more confident going in. And then if you don't know the answer to a question in an interview, you've got to kind of own it and almost fess up and have something else to share with them. But I wouldn't then go into a long story which is trying to sort of cover your tracks. If you don't know the answer, you don't know the answer. So, okay, I'm going to open up now to questions. And while you're doing that, I'm going to just quickly also go through. So if anyone would like to meet up with me for a free session, and I'm giving you these final slides now in case people need to leave. You can book one via my website. That's the homepage. And the upcoming events are listed there also. As I mentioned, I've worked with a lot of doctors in the last 10 years across all different levels and different specialties. And these are some of the sort of situations where senior medical officers are seeking me out and are asking for assistance. And that's an overview of some of my key services. So planning and CVs and interview training and everything else in between. I had almost a 2-hour session with one of my clients today who reached out. She's had a lot going on. We've been working together since the end of last year to help her navigate a very tricky situation that she is in, and she's a senior medical officer and doing other work in another organisation as well, in addition to her clinical work. So, whatever's going on, I work with doctors to assist them through those situations. Couple of upcoming events I wanted to mention. So as I said, the interview intensive is on the 3rd of May for 2 hours. I'm really keeping it to 10 people. There is the link on the website that involves a small fee. Most of my webinars are free, but that one, it's $97 plus GST. And so that'll be packed full of content that you'll be able to use, and an opportunity for practice in a small private setting. And then a couple of other trips that I'm doing around the country. I like to let people know that these are coming up, so that if people want to catch up, we can get together and meet over a coffee and have a chat. So Tasmania, Canberra, and northeastern Victoria, and then Adelaide later in the year, and I'm not sure where else yet, but there's usually a few other places that come up at this time of the year. So please get in touch if I can be of assistance to you, and if you have any questions that you'd rather ask me in a more private setting than this session. So going to stop sharing now, and thank you all for coming. I hope that's been helpful, and I will also stop the recording.